when I was in my gap year position, I was actually in charge of interviewing who was gonna be my replacement, essentially. So I thought it was really cool being on the other side of the table, screening resumes, asking people questions, and like coming up with the questions to ask them about their application. And that brings me to my first tip, which is to know your application. This might seem really obvious, but you would also be surprised how many people show up and not know exactly what they put on their application, or maybe they don't remember what they put on their application. And so what I would recommend is the day before your interview or 2 days before your interview, read the whole thing again, know what's on your resume, know what you sent to the school. And while you're reviewing your application materials, you can also kind of try to anticipate what sorts of questions might come up. So for example, you really struggled with your GPA your freshman year. Now that might come up in an interview, so you have to be prepared to explain that. If you did a ton of research all throughout your years in undergrad and you wrote about it a lot in your application, be prepared to talk about research. Another thing I want to remind you guys is if you use like nicknames for your patient anecdotes in your application, so for example, instead of the patient's real name, you called them John or something, make sure you know what name you gave them, because at the interview, they might be like, oh, I read about your experience with John. Like, you don't want to be caught off guard and be thinking, who the heck is John? Like, who did I call John in my applications?